everyone, and welcome to Rural Roots, A Road Less Traveled, a podcast by North Country Healthcare.
We're your hosts. I'm Gavin Cook.
And I'm Ren Anderson, and we're so glad you are here. Gavin, we have Jesse Raymer here with us this morning. Jesse, thank you so much for joining us.
Thank you for having me. I love your podcast. Continue the great work.
Thanks, Jesse. Well, you know what? When we start the podcast, each time we like to ask our guests a little bit about their road less traveled and how they got to North Country Healthcare. You want to tell us a little bit about yourself and what brought you to your current position?
Yeah, it's we all have a road less traveled, I'd say, and I've been working in healthcare for over a decade now, and my path here was definitely not a straight line. So I actually started my career as a radiology tech in healthcare. I got to see firsthand how critical it is to have the right equipment and supplies ready when you need them. In radiology, it's contrast or protective gear. In that early experience, really, it kind of taught me about how the supply chain impacts patient care. So before that, I actually served in the United States Army. That gave me really a deep appreciation for logistics and teamwork and staying calm under pressure. And all those skills I found have really translated perfect into supply chain materials management in healthcare. I grew up in Western Massachusetts, but I've been lucky enough to live and work all over the world. And those experiences have kind of given me a global perspective to help me understand that no matter where you are, getting the right resources in the right place at the right time is always the challenge and the reward. So it's been interesting. So moving into materials management and up into North Country Healthcare, it felt like a natural fit. It helped me combine my clinical background, logistics experience from the military, and then supporting the frontline caregivers so they can focus on what matters most, the patients. So, lived up in the North Country for over a decade. My wife and I live up here, have two beautiful children, raising our family, and we love it here every day.
Wonderful.
Awesome.
And what do you do outside of work? I just think this is important, Gavin, because we heard from Tom last week and just how much, or a couple weeks ago now, and how much being in the wilderness and hunting and fishing really motivates him and how he makes space for it. What do you make space for outside of NCH?
Well, definitely not hunting and fishing. Being in the Army, I've got to be exposed to many different outdoor scenarios, and I tend to stay away from that now. But I will say live sports I love, golfing, and I have I have a big fascination with curling. To the point where my family gets together every year for over a decade, once in the winter in a backyard with some ice, and we just do some curling. So it's really neat.
Amazing.
And Jesse, I know you and I have talked golf before and how we'd build it into, I think, every day if we could. But speaking of that day to day, I'd love to hear kind of what your day-to-day looks like. I know it's probably not the same every day. I know firsthand that you're running around a lot, but I think our listeners would love to know.
Yeah, I think my day-to-day, I'll put it more in perspective of the team. As we continue one team, one mission, I always consider it our day-to-day in supply chain because we're all showing the challenges. So you think about, imagine this, before the sun even comes up, there's the supply chain teams are already moving. We're checking inventory levels and making sure everything from surgical gloves to IV fluids are really in stock and ready to go. So once we check it throughout the morning, we have a distribution team. They're packing up deliveries and they're logging everything into a hospital inventory system. They're responding to urgent requests too. If a unit all of a sudden needs more syringes, the supply chain team is on it. So the afternoon is distribution runs, moving supplies from a main warehouse to the different hospitals and to the satellite clinics. It's obviously a mix of different types of work, physical, loading carts, and data work. We have to make sure everything's tracked so nothing goes missing. Afternoons is really, that's problem solving and receiving. Maybe I'm negotiating with a vendor on pricing. Maybe there's a back order of a critical supply. Maybe a piece of equipment broke. You never know. Supply chain teams and myself, we have to find solutions quickly, because you think about it, if the hospital doesn't have the right equipment or supplies, patient care can grind to a halt. We don't want that to happen. Then, we're doing constant improvement projects. We'll work on better inventory systems, finding cost savings. And I say that like that because it's, a lot of people, how do we drive down the cost of healthcare? I actually get to work in a role where I am trying to drive down the cost of healthcare, or at least keep it at the status quo, which it fills my cup every day. So we collaborate to make sure the right products are being used with the clinicians as well. So a lot of times, a lot of people that work in the organization, they don't see the supply chain team, but they are the quiet engine that keeps our organization running smooth day after day. So,
all right. And Jesse, speaking of the team, I think myself included here, I'd love to know where, in terms of location, the supply chain team is located.
Oh yeah, that's a great question. We are everywhere. So the team, we have a distribution center that's located in Littleton, New Hampshire, right near a major highway. Most of our supplies for our system will come into there, and there's a distribution team that receives, manages, and distributes to our system. Each one of the affiliates and hospitals in our organization have an on-site rep, and that's the go-to person, and they're the ones checking inventory levels, replacing inventory, working with the on-site clinicians to make sure they have what they need. Also, we have a buyer group who they're either on-site or off-site, but can be reached throughout the system, and they all share responsibilities to make those purchases for the departments. So,
yeah. Fantastic.
Well, and Jesse, I think we would be remiss, and I don't want to dwell on it too much because she's coming up as a guest, but to talk about home medical supply a little bit and our retail outlet and endeavor over in Littleton.
Yeah. What an incredible effort that was. It's if there's something we could talk about that proud of NCH and what we've been able to achieve over the past few years, that project stands out to me, and it was a huge effort. We were essentially building something from the ground up that didn't exist in our area. It didn't have a good service reputation in our area, so we had to find a location, identify vendors, become accredited, create ordering, inventory systems, and then really we had to make sure we had the right equipment and supplies for the patients who want to stay in their homes. So I think what made me especially proud of that is how collaborative it was. We worked closely with the boards, administrators, clinicians, and patients to make sure we understood their needs. And seeing that company up and running, knowing that we're helping people to get the equipment they need without having to travel far, it's just incredibly rewarding. So I highly recommend anyone who hasn't been to the store or has called to reach out.
Yeah. And NCH employees do get a discount too.
That's
and
right.
they deliver. What's
That's
not
right.
to love?
That's right. Absolutely.
So,
Give
had to
them
get
a
the-
call anytime.
And Jody and the team over there are great. So
Yeah.
you're lucky to work with such superstars across your whole team.
Yep, they all are. Every one of them is a superstar in their own right, and NCH has a supply chain that cares. They care about their mission. They care about supporting clinicians, and they care about that surgeon, or doctor, or nurse, or MA, a medical assistant that needs that item to provide the care and make our patients feel better. So.
That's great. And I think we touched on it a little bit earlier about some challenges that you and the team face. And obviously our podcast title is Rural Roots. So I'd love to know what one or two biggest challenges you see being in a rural area with supply chain. What effects does that have?
Yeah.
And are they different, I think,
right.
too? Are they different from other areas?
Right.
Yeah, that is a great question. I was fortunate. I did work in supply chain in an urban area, and I love this question because it's night and day. So, first off, for rural materials management, it's vendor access. Rural areas, there's not as many distributors nearby. It means longer lead times, higher freight costs, and fewer options if a product is back ordered. If you think about it, if you run out of something critical, it's not as easy as running across town to pick it up. Other thing is budget pressures is another big one. Rural health systems, we often operate with tighter margins, so supply chain leaders have to be creative. When that is negotiating prices, managing inventory to reduce waste, or just simply finding ways to do more with less. Another thing I noticed was technology gaps. Some rural facilities, and they don't have the latest inventory management software or automated supply cabinets that some of these urban systems have. There might still be a lot of paper logs and spreadsheets and phone calls, and that can slow things down. It's really what happens. We at NCH Supply Chain, we maximize the use of our inventory system, but there's always some parts where it could be better. So, and then finally, it's probably one of the bigger ones is the challenge of emergency preparedness. Rural hospitals can be the only healthcare option for miles, sometimes hundreds of miles. And running out of a critical supply during, say, a snowstorm or a flood or a highway closure, a bus crash, or whatever, we have to think ahead. We have to build buffer stock and plan for worst case scenarios. So, in the end, the NCH materials management team is incredibly resourceful. We've built really strong vendor relationships. We get creative with substitutions, and we've been able to keep patient care running even when the odds are stacked against us. So, credit to all of them.
And I imagine you're always running the risk of an oversupply if you don't need things before they expire. I don't think the normal person thinks about gloves expiring or masks expiring, and I know your team just keeps such a good handle on that, so our staff really doesn't have to think about it.
Yeah, and that's what we want.
Yeah. And how else do supply chain and clinical care intersect in ways maybe people wouldn't expect?
Oh, well, that's pretty much everywhere, believe it or not. It's funny. We can start with just the products we select. If before a nurse ever opens a box of gloves, we want to make sure the nurses are happy with that box of gloves. It's before a surgeon picks up an instrument. We need to work with the clinicians and the surgeons to make sure it meets their need and decide which products are the safest, most effective, and cost efficient in the end. Mm-hmm. Another thing, you talk about procedure readiness. Have you guys ever wondered about how an operating room has exactly the right implants ready for surgery? Does anyone think about it? We do. We're behind the scenes making sure those items are ordered and delivered on time. And you got to think of the downstream effect of that. If we don't have a supply, the case can be delayed. Well, that's affecting one patient, but it doesn't just affect that one patient because the whole OR schedule has to be changed and could affect several patients. So another big role is infection prevention. You know, the choices that we make on products for gowns or drapes or masks or even cleaning products, they really can make a difference in the hospital-acquired infection rates. So, yeah, that, and then the last one we'll go back to one of the biggest intersections you'll see is during a crisis. You think of COVID-19, that's a perfect example. Our clinicians couldn't care for patients safely without PPE, ventilator parts, medicines, and its supply chain teams were the ones scrambling to source them, often from across the globe. So it's interesting. And then just being data driven with that, supply chain data can help clinical teams see what products are being used the most. So sometimes you think of supply chain as a back office function, but it's really a partner in patient care, and it's we quietly shape safety, quality, and efficiency every day.
Well, and you say quietly, but I imagine along with being very resourceful, someone who works in material management also has to be a good communicator and really listen to what the needs are, maybe more intently than a lot of our staff does on a day-to-day basis, because they need to be aware of it before it's expressed as a problem.
Yeah, and I've noticed in supply chain, there's no education per se to understand what every product that we carry does. If you think about someone who specializes in oncology, they're using the products in oncology, they know them well. Or the ORs, they know them well. Supply chain has to learn about all of them in the most they can. And I will say there's never been a day that I haven't learned something new. And it will continue to be that way for the rest of my career.
Well, speaking of learning something new, I always tell Ren that my favorite thing about these podcasts is I feel like I get to learn something new every day when we do these, and it's great. But I've slowly developed a bit of a favorite question here, and it's as we wrap up. But I love to know from our guests what keeps you motivated every day? What makes you wake up every day ready to come to work and start the day? What keeps you, Jesse, going?
Wow. Yeah, that's a great question. I think of the times, there's good times and bad times in every profession. And so the motivator, I always think about what brings me back in the bad times. And in rural healthcare, it's community. There's no other answer for me. Community is at the heart of what we do. Every day we work to make sure our clinicians have the supplies and service they need to take care of our patients. And knowing that our work helps meet those needs and ultimately supports the people in our community, it just makes it incredibly rewarding. So basically, we keep the system moving so the team can focus on what matters the most, and that is taking care of patients. So.
Perfect.
Yeah.
And I think that one of the missions or one of the goals that North Country Healthcare has is making healthcare cool again, making the career cool, right? And so I wonder what you might say to a young person who's thinking about a career in healthcare and maybe why they might be a good fit or why they should consider materials management. And what do they need to get there?
Yeah, I think, boy, that's a great question. It's hard. I think sometimes it's hard when you're young to know what you want to do. It would be, if I met someone that's younger, that'd be like, I want to be in healthcare supply chain, that would be the first person that I met. they, they, I find, the thing is they can help their community in a different way that doesn't require maybe a big degree or a huge college education. It's a field you can get into and move up in healthcare, and you can get your foot in the door, with a high school diploma, and that I think is great because you can't necessarily do that as being a nurse or whatever. So for the young people, I say don't look past this, because this, if you start that when you're young, you're going to grow to whatever level you want in 10 years. And there's always a need for people doing supply chain. So yeah, boy, I'd like to see more of them.
Yeah, great. We'll get you at the next career fair, Jesse.
All right, excellent.
Perfect. Well, any last thoughts before we wrap up?
No, I just thank you for doing this. I've started to become a huge fan, and this is good work. I love hearing from everyone that works in the system. You guys ask great questions, continue the great work, and we'll come together as one team and keep moving forward.
That's right. One team, one mission.
Yep.
With us, we love to learn something new, like we said, every day. So, thank you.
Thanks, Jesse.
All right, Ren. What a great episode. Jesse is always a good conversation. He's never one to bore you, that's for sure.
Mover and a shaker, and probably the epitome of resourceful. So he's in a great position, and I'd love to hear how he supports his team. And it really seems to be the center of everything he does.
Yeah, I was just gonna say his team. Anytime I've reached out to anyone, they are on it. They're more than willing to go above and beyond what you need, and I think that kind of starts with him. It's clear that that's how he operates as well, and like you said, it's patient focused and patient centered, which is what it all comes back to. So it was a great conversation. But I will toss it to you to intro our next guest.
Yeah, so next up we have Danielle Roy. She is a clinical supervisor of cardiopulmonary services, and that means she's also a registered polysomnographic technologist. And I think I get all the quarters for being able to say that, or I think I said it.
Absolutely.
But Danielle is wonderful. I sit on many committees with her. She gets involved. She's on the One Team, One Mission committee. She's on our ethics committee. She's on our HRO committee. And she it has so much energy and is so passionate about what she does. So really glad that she's going to be our next guest.
Absolutely. And I'm also on a committee with her, so I'm excited to hear about her actual line of duty and her day to day, because I see her in a different realm every day, but I'm very excited to have her on.
Yeah, it's funny how a lot of the people, and I think you probably have this experience too, Gavin, but sometimes I don't know what people do when we're on our committees with them. Okay. So I'm always just so excited to learn about something new.
Right. Looking forward to it.
Yeah. Well, until then, I'm Ren.
And I'm Gavin, and this is Rural Roots, a road less traveled.